Welcome back for our Ardenwood Presents webinar focused on Medicare for Christian Scientists. I'm John Mitchell, and I serve as Executive Director and CEO for Ardenwood here in San Francisco. I'm joined by our presenters today, Jim and Nancy, who are here again to answer your questions. And from what we've seen, there are many, which is why we offer these sessions. So thank you for joining us. There will be one more Q&A session on Thursday, November 9th, so please register on our website and watch for the email reminder. Now, Ardenwood supports the Ministry of Christian Science Nursing in our facility and in the field through our visiting nurse, Christian Science Nurse Service, along with online events like this one. We also mentor Christian Science nurses throughout their training. As a 501c3 charitable nonprofit organization, Ardenwood depends on financial support to help provide the highest quality of uninterrupted care. We are always thinking of ways we can better serve you, and this is one more way. Thank you for your thoughtful and generous contributions that make our work possible. They make a real difference, truly, truly, truly. Now let's talk about today's webinar on Medicare. Some of this intro will be repetitive for those who attended on Tuesday. So why is this information important for a Christian Scientist to know? Well, because it's a big help when it comes to paying for skilled care. Skilled care is the kind of care someone would require or receive in a hospital. And friends, it's expensive. Hopefully, one will never need skilled care. But in the event that you do, Medicare is an option for those of us who are 65 or over, and we've all paid into Medicare throughout our working lives, paycheck by paycheck. So the funds are in place to be used if needed. And let me make a very important point here. There is no difference in the care you receive at Ardenwood if you're on Medicare or not. It's exactly the same care. Medicare simply helps you pay your bill. I also want to emphasize the true wisdom of giving thought now to creating a personal care plan so that you or a loved one are prepared if there is ever a need for Christian Science nursing care. In that situation, you want, and we want, your focus to be on God, on healing, and not on your bill. Thinking through your options in advance relieves anxiety and eliminates fear, yours and your loved ones. It's that simple. One other point that's important to know. Medicare coverage is essential if you ever find yourself in a care setting that's not your first choice. Ardenwood is designated in federal law as a religious, non-medical healthcare institution, or to use the term RINKI for short. So as a religious, non-medical healthcare institution, or RINKI, we are a Medicare Part A provider. One perception of Medicare is that it requires you to share too much information about your physical well-being. As the payor, Medicare wants to ensure that the care received should be covered. We have found that Medicare is much less intrusive than most insurance companies. Here's what Medicare expects from a RINKI like Ardenwood. A RINKI, and this is from the law. I'm reading right now from the law on religious non-medical healthcare institutions. A RINKI furnishes non-medical items and services to inpatients on a 24-hour basis. A RINKI does not furnish, on the basis of religious beliefs, read Christian Science, through its personnel or otherwise, medical items and services, including any medical screening, examination, diagnosis, prognosis, treatment, or the administration of drugs for its patients. That's pretty clear language in the law. So we report only general information to Medicare because, as you know, Christian Science nurses do not diagnose or conduct any screening, examining, or administering of any drugs, which is consistent with Christian Science and, as read, the law. And two final points before we begin. First, the content shared today is only informational and is not intended as legal advice. And second, a replay of both Medicare webinars this week will be available on our website in the next day or so. Replays of all our webinars are also available on our website, ardenwood.org. And as a quick reminder, you can always ask questions by using the Q&A button at the bottom of your screen. Now, let me reintroduce today's presenters. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He's also a certified long-term care insurance strategist. Jim has talked to thousands, literally thousands of Christian Scientists since we started these webinars over 4 years ago. He's happy to answer questions about Medicare, long-term care insurance, and estate planning. Jim has been a tremendous blessing to our field. And from what he has told me, he enjoys meeting and working with all of you. Nancy Sedan is our finance director here at Ardenwood. And through her work for us, she has many years of experience with Medicare and other healthcare insurance policies. So let's get started. Jim and Nancy, I've got a whole raft of questions right here before me.
Hi, John. Hi, Nancy.
Hi, Jim. Hey, Nancy.
Hi, Jim.
Let's dive in. Does Ardenwood accept Medi-Cal? I have Medi-Cal and Medicare Part A and B. I will be 90 years old in January of 2024. My only income is Social Security.
I think that's a Nancy question.
We do not accept Medi-Cal, but we are a Medicare Part A provider. And so you said you have Medicare Part A, and yes, that would cover you should you have a need that qualifies for Medicare.
Exactly right. Next up, I have a question regarding federal employees who are members of the Federal Employees Health Benefit Plan. There was no advice given when I retired, so I signed up for both Medicare and FHBP, which I guess is the Federal Employees Health Benefit Plan.
Right.
It seems like I am paying awfully high premiums and wondered if I could drop the Medicare. Would I get a reduction in premiums? I think FHBP and Medicare have some type of reciprocal agreement, but I'm not sure what it is. Can you please address this?
Yeah, that's a tricky one. And here's a great resource for you. I don't know if you can see it. This is the 2024 Medicare and You Guide, which you can get as a federal employee, and anybody can get it actually. And I've had that question asked. That's exactly right, John's got it right there. But you can look on page 89. It talks about the Federal Employee Health Benefits Program and the website you should go to and the number you should call to get that information. Last thing I want to do is give out some type of incorrect information without knowing all the details. I know you gave us some. So I'd highly recommend, it's on page 89 of that book, John, that they go there and check. I'm not as familiar with the Federal Employee Health Benefit Program as an expert would be.
Jim, as they probably don't have the book like we do, could you please go to page 89 and just repeat the number quickly in this?
Yeah, sure. I'd be happy to. So, and the easy way to get this too, anybody can get this booklet. You simply go to medicare.gov and download the Medicare and You booklet, and they just updated it for 2024. I put on there, that's my copy because if people want to grab it. So you can simply go on and download it. But on there, there's a number. You can call the Office of Personnel Management at 1-888-767-6738. That's what Medicare recommends to get the answer that you're looking for. So
one more time, give us the number.
One more
please.
time, the Office of Personnel Management is 1-888-767-6738. Hopefully that helps.
Jim, thank you for that.
I've had those questions already. So
wow, there you go. This is so helpful. I'm not familiar with that question. That was a good one. A new one for our side of things. Next up, what are the positives and negatives about an Advantage plan from the perspective of someone who wants to access care in a religious non-medical facility? I believe one of you said they did not recommend Advantage plans for most Christian Scientists. I'd be interested in knowing the reasons. Nancy?
Sure. Yeah, let me start with that. As you may recall, if you listened in on Tuesday, your Medicare benefit, you have two choices. One is the original Medicare, which is Part A and Part B. and the other is a Medicare Advantage, which sometimes is called referenced as Part C. The Advantage plan is managed care. It is you can access your Medicare benefits through a insurance company that has a limited number of providers, and you have to access that care through an individual physician, care provider. So as a Christian Scientist, if you have a care need and you wish to come directly to a Rinke or Ardenwood, you would need to have what's called prior authorization or pre-authorization from this primary caregiver. They would have to have recognized what your care need was, perhaps given you an exam, perhaps diagnosed, and to authorize this. We, of course, don't do that here in any way, but they require a pre-authorization before we can accept you into Ardenwood. Although sometimes an individual arrives and we work on it while they're here to get this prior authorization. So that's one main difference. The other one is that a managed care, a Medicare Advantage plan has a network of providers that are all medical, and we are not in that network, though it's important to understand that you are, by law, supposed to be able to access your Rinke benefit through a Medicare Advantage plan. The law says that that they have to offer everything that original Medicare has. But however, not all Medicare Advantage plans, or I should say the majority of them, are not familiar with that law, that they have to offer that. And so there becomes issues with this prior authorization requirement, and also when we try to bill when we've provided services for someone that has a Medicare Advantage plan. So I hope that summarizes some of the key issues that you might face if you were in a Medicare Advantage plan.
Well stated, Nancy. And I think, Jim, you said too that there are more and new Medicare Advantage plans every day. So there's a huge proliferation of these. And imagine, as the listener here, that we as Ardenwood, say someone comes in with an Advantage plan and we provide the care, thinking that we will be paid, and we might never be paid, or we would be paid 1 or 2 years later, if at all, as I say. So we're, as an organization, completely out of being remunerated for the services provided. Think of that. So it's really not a good system.
And to add to that, a good point, John, I have seen numerous cases where we have to work with a Christian Science Provider Network, which is a wonderful group of Christian scientists who are very familiar with Medicare and insurance, to actually appeal the fact that we haven't gotten paid. And then the patient has to sign the appeal, and sometimes it goes to a second appeal. Eventually, we've had very good success in getting paid, as John said, but usually at least a year, if not longer, because people have to get educated. And of course, that's a good opportunity for us to share what Christian Science is. But those are some of the issues that we face.
Tough to run a business like that, John, right? Waiting to get paid a year, hopefully.
Yeah, just doesn't work. So anyway, I hope that answers the question. I'm sure we'll get some of those questions again, but that's a little behind the scenes look at what we're dealing with Advantage plans that we call actually disadvantaged plans, as you can understand. Next up, it sounds like a Medicare supplement can be added at any time, or is it just during these 2 months?
Right. That's a really good question. You can add a Medicare supplement anytime in any state, but here's a big but. You have to be healthy enough to get it. When you start your Part A and your Part B, you have a guaranteed open enrollment period of 6 months to get a supplement. And I don't see that very much in the Christian Science community, but outside there, that's super important. People aren't as healthy as Christian Scientists, and they have that 6-month window. And the 7-month and beyond, they have to qualify medically. They have a series of health questions they have to be answered. And if any of them are yes, they can't get it. So the answer is you can apply anytime, any month during the year, and you just have to be healthy enough to get it.
Thank you, Jim.
And you have to have Part B in place already. Isn't that right, Jim?
Absolutely, yeah. You
Yeah.
have to absolutely,
Mm.
yes, you have to have, that's assume you've got A and B, right? You have to have B,
Mhm,
both of
mhm.
them active, correct?
Perfect. Next up, can I qualify for, here you go, Jim. Can I qualify for Plan F, as in Frank, since I was born in 1954? I was told that it had been terminated.
Right, yeah, no, Plan F is still around, and a lot of people don't understand that, but the government said that plan was too benefit rich for people, Plan F. Plan F has no out-of-pocket costs. Everything is covered in full. So if I'm under Part A, there's no deductible. I have 100% coverage. Part B, no deductible, 100% coverage. Well, they took that away, but you can still get it. If you're born in 1954 or earlier, you can still purchase a Plan F. Plan F was great. It's easy. I have a lot of clients that just want easy, John, right? You go into retirement all these years, there's a hassle. You don't want to worry about a deductible. Plan F makes it simple. The only difference, and people are going to ask, between G and F is G has a Part B deductible next year of $240, and the premiums are normally a little bit lower. But yes, you can still get Plan F if you're born in 1954 or earlier.
Easy is helpful, Jim. It is. Okay, number 3, or next up, I should say. Is a physical exam required to get a Medicare supplement plan, or do we just need to answer health questions? Good question.
Right? Yeah, no physical exams. That would be kind of life insurance side, but you just have to answer the health questions. And again, as long as they're all no, you can qualify for the supplement plan at any time.
Great. Next question. Are the Christian Science Rinkies, or religious non-medical healthcare institutions that were listed at the end of Tuesday's presentation, the only ones that are Medicare certified?
Yes, at this time.
Good question. Why do you recommend AARP, United Healthcare, or UHC Supplement Plan G? We have Aetna and are thinking of switching. Can we do that during this open enrollment period?
Right. Well, the answer to the last part, yes, you can change at any time. The open enrollment period, or the annual election period, as many people call it, that really pertains to your Medicare Advantage or Part D plans. People that have supplemental plans, like you said, you can try and change every month. I'm a big fan of AARP, United Healthcare, simply because my clients don't like hassles. They pay their claims. They have an incredibly large block of business. And then that's insurance lingo for saying if they have 4.5 million supplemental policyholders, they can spread that risk over everybody, right? Versus a company that may have 300,000 to 500,000 on the books. And so I just know that AARP only endorses one company in the senior market, and it's United Healthcare. I actually have them myself. You'd mentioned Aetna. Aetna's a fine company, but I look at I want the track record of rate increases, and United Healthcare has the lowest overall. And that's super important as we age, because they tick up with age, and some of these companies can have incredibly high rate increases as we age, and you don't want that.
Thank you, Jim. Remember those old commercials? AARP, ask for it by name.
Jim, that actually a follow-up question on that. Does that mean that your premium for your supplemental plan increases each year?
Yeah, it depends on the state, but yes, it normally ticks up just a little bit with age every year. That's the most common you see. That can also be subject to, you can also have a rate increase. It has nothing to do with you ticking up in age. That's why it's so important to be with a company like AARP United Healthcare, because they have so many policy holders on the books. And again, right, that spreads that risk out, and that's super important with insurance.
Excellent. Next up, I only have Part A of Medicare. Can I add Part B now? I want to get the supplemental Plan G.
Right. Yeah. Unfortunately, you can't add Part B right now. Starting January 1, they have another enrollment period called the general enrollment period that starts January 1 to March 31st. And that's when you can add Part B. Once you have, like Nancy said before, once you have A and B, then you can apply for the supplemental coverage, but you've got to have Part B.
Thank you. Now, once again, friends, this is why we offer these webinars. It is confusing.
Yes.
Next up, how do I know if a Christian Science care facility will take the AARP supplement plan?
Well, that's an easy answer for me. If your care is a Medicare level, then the supplemental plans automatically pay. So if Medicare is going to pay and you have a supplemental plan, then we're able to process that claim and get it to pay as well.
Now, some of these questions are redundant, but I'm still going to ask them because I think it's good to hear these repetitively as well. So I have a Medicare Advantage plan and want to change to a supplement plan. Can I do that now?
Yes. Now is the time that you can disenroll from your Medicare Advantage plan and get the supplement. But you've got to do it in this order. You've got to make sure that you can answer all the health questions, no, right? So that we know that you can absolutely get the supplemental plan. Then once that happens, then we can drop your Medicare Advantage plan. You don't want to just drop it and apply. You want to make sure that you can get the new plan first, then you can drop it. And that would all be effective January 1. That's when you would run out 12/31 for the Medicare Advantage and the supplement would start January 1.
So this is, you can always call Jim, as we indicate throughout this webinar. So if there's a challenge with that, you can ask Jim.
Right. I know, I apologize, John. I don't mean to go too fast, but yeah, please email me. I've been getting a lot of emails and I'm happy to respond. Sometimes get a little overwhelmed after the Zooms here, but I'm happy to, and it is confusing with all the different enrollment periods. So
I think it's time for a commercial. Nancy, can you tell us about advanced healthcare directives and why they're important?
Sure. The Advanced Healthcare Directive is a legal document that allows you to appoint someone that you trust to make your healthcare decisions in the future should you ever be unable to make them yourself. And so it's a document that helps you think through what choices would I want to make in certain situations. It also allows you to then discuss your choices with perhaps your loved one or whoever you've decided to appoint to make this assistance for you. And we found that families this is a good opportunity for families to sit down and talk things through that perhaps you might not otherwise have a chance to do. It also is very helpful for us. It's one of the documents we ask if someone comes for care. If you have it, we want a copy of it. It's also helpful if you were ever out in public and a friend wanting to help called 911 and 911 took you to a hospital and you wanted to be in a Christian Science care facility rather than the hospital. The individual who you had appointed through this healthcare directive could speak on your behalf and would have legal authority to do so and could help you move at the appropriate time. So this is a document that you want to make sure that person has a copy of. It also, you can have alternatives to, it doesn't have to just be one person if that person is unavailable. Sometimes having a electronic copy of it has proved useful as well. So you would want to have the individual you've appointed also have a copy of that. And as I think we said on Tuesday, also having it right on your refrigerator sometimes is a good idea, just in case there was a need in your home and other individuals were coming to help assist you. They would see that and know who else was able to make decisions for you.
Thank you, Nancy. Yes, we want to make sure that the Advanced Healthcare Directive is able to be located. That's why you put it on a refrigerator or give it to someone, because you might be asked, well, you would be asked for that actually. But say, for instance, to play this out a little bit further, if you were taken to the hospital, I know this because this has happened to me. If you don't have a healthcare directive in place, it's likely that you would not be able to leave the hospital until one were fully taken care of. In that period of time, a huge bill can be racked up. I mean, just as I'm speaking from personal experience. So you want to be able to give the loved one the authority with the document to be able to help you fulfill your choice of care. Because otherwise everyone's trying to do the right thing. But if you don't have something in place, that makes it incredibly difficult. We've gone through this with other patients here at Ardenwood, where they're taken to a hospital, very difficult for them to get them out, even though they've requested to do so. There's nothing in writing that proves that. So it's better to have the document ahead of time in terms of an advanced healthcare directive. You can go to our website, ardenwood.org, and download a copy. So,
And
okay.
John, it's so important too. I talk to many Christian Scientists who go, well, I don't have Part B. I go, well, then you're going to pay that out of pocket, and you're not going to get a discounted rate from Medicare. And the billed amount can be scary out there. I've seen $30,000, $40,000 billed amounts for just a quick emergency room visit. The advantage, even if you have Part B, at least, you're going to get the Medicare approved rate, which is normally going to be lower, and maybe instead of $40,000, it may be only $28,000, but you would be limited to pay 20% of that. That's why when we talk about supplements, it's so important to realize, hey, you pay a smaller monthly fee. And if you have a supplement, then you don't worry about going to the emergency room. On that Plan G we talk about all the time, your exposure next year is $240. That's it, period. So you don't have to worry. It's one less thing to worry about, right? As we age, you can focus on your spiritual faith and not have to worry about these things. So,
and it's a comfort to family members too. And so we're trying to just paint a full picture here, not trying to alarm anyone or anything of the sort.
Right.
It's just having a plan in place.
Yes.
That's what this is about. Okay, back to questions. I do have Medicare Advantage. I do have a Medicare Advantage plan, and I am paying a penalty. Not sure why, but you mentioned something about Part D penalty. Is that happening to me? Is that what is happening to me?
That's a tricky one, right? Because I've seen many Christian Scientists out there purchase the Medicare Advantage plans. I don't know if they're purchasing so much as being sold. They're being told, hey, this is better than nothing and you should have this. Well, if I've been I'm a Christian Scientist and I haven't had any Part D coverage for, let's say, 10 years, and I'm 75 and I buy one of those Joe Namath, those low cost, no cost Medicare Advantage plans. Well, even though I'm paying zero premium, they go, well, listen, you haven't had a Part D plan for 10 years, which is 120 months. Even though it's in part of that Medicare Advantage plan, it's all bundled together, you're still going to get fined. And they don't tell you that up front because nobody knows to ask, first off. And most agents who aren't working with Christian Scientists don't know that. But yeah, you're going to get fined. The government says we're going to take 120 months times, I think next year it's 34 cents a month. So you're, probably $40-some a month penalty, even though you're paying zero premium. So now is the time, if you want to get rid of that penalty, right, is looking at go back to original Medicare. At least you lose that Part D penalty, right? Did that make sense to everybody? I mean, they bundle it together. They don't tell you that, and then you think you're paying zero premium, and you're getting these bills for $40 or $45 a month saying that's a penalty, simply because you didn't sign up for it when you were first eligible.
Tricky business. That's why we're having these webinars. Thank you for that, Jim. Jim, I talked to you last year about nationwide long-term care plan. I'm still interested. I do not want to do any type of exam for that plan. Do you have any other options?
Yeah, I've talked to probably a couple hundred of you out there about that plan. Yeah, sometimes it depends on your age. They may require a physical, right, where they ask you the health questions, height, weight, things like that. And I understand as a Christian Scientist, some people you may not want to do that. Well, that's okay, but we can't get that particular plan. There are other options out there. I've used, I know annuities out there, which I don't want to go into, but that's another product that would triple for care. So for example, John, if somebody had an annuity and they put in $100,000, whether it was cash or a transfer, the Christian Scientists answering all the health questions can triple that amount for care. So if they did need care, 100,000 would turn into 300,000, right? It's kind of, those annuities are kind of designed for care. But again, it's all based on your health. So that's another option. And again, something like that, there would be no physicals required at all, simply answering health questions.
Perfect. Next up, would someone who is 87 have to pay for 22 years of 20% to add B now? Plan B?
Yeah, you would have, they look at for every 12-month period, right? They're going to charge you 10% of the Part B premium. So that's a lot 12-month periods. So you're right. If you look at 65 to 87, that's 22 years. That's a pretty heavy duty fine you'd be looking at. So that's something where you'd want to look at your finances and really think and pray about it and decide if that's what you would want to add on, right? Because if as long as you don't have to go into an emergency room, you're okay, or have any treatment under Part B, you'd be okay. If you just went into a Rinky, for example, that's under Part A. But you would really, I'd be happy to talk to you and do the math, but that's quite an expense, right, to come up with.
Thank you. Are Plan B premiums deducted from your Social Security?
If you're on Social Security, they are deducted, every month. If you're not, they simply multiply the monthly premium by 3 and send you a quarterly bill. The government does not send out monthly bills, they send out quarterly bills, but they allow you to pay monthly. So if you want to use a credit card that has points, for example, and pay it monthly, you can do that. You can set up they call it Easy Pay with Medicare, where they will take it out of your checking account every month too. So there's other options, but if you're on Social Security, it automatically comes out of that, your deposit, I was going to say check, your deposit every month, or again, they bill you quarterly.
Thank you. Is long-term care insurance provided for in-home assistance or assisted living?
Yes. So a comprehensive long-term care policy covers somebody if they're at home, if they're in assisted living, residential care, and normally a long-term care facility, not like Ardenwood, but a long-term care facility is more for the end of life and the non-Christian Science community. So it would cover you in all those facilities. Also, Nancy, it could be used at Ardenwood, right? If it's coded under skilled nursing and not Medicare.
You mean if the long-term care policy covers skilled nursing?
Well, I know it does, right? There's
Okay.
certain type of like the nationwide policy pays somebody a cash benefit. So if I have that cash benefit, I can use it to pay my bill at, for example, Ardenwood.
Sure.
I can hire my grandson to mow my lawn or pay my neighbor to take him to the doctor. I can do anything I want with those monies. If you have a
Sure.
regular reimbursement policy where you have to incur that expense, that would not help you at Ardenwood, for example.
Mhm.
Your grandbaby is not old enough to mow your lawn yet, is he, Jim?
Well, you're okay.
Just kidding.
Your nephew.
Regarding Part B, is my income, let's start over. Regarding Part B, if my income was higher when looking back at my tax returns than it is now, do I pay a higher premium at the start and going forward, or will the premium amount drop?
Right. So how they look at your premiums every year. So for 2023, they're going to pull your 2021 tax return, and they look at your modified adjusted gross income. It's essentially your adjusted gross income, and if you have income that's not real common, like tax-free muni bond income, savings bond income, foreign income, things like that, they pull it back into your calculation to bump you up in the bracket. They don't do any favors with the modified adjusted gross income. So again, every year they do a 2-year look back automatically, whether you want them to or not. So in 2024, they're going to be looking at your 2022 modified adjusted gross income tax return. 25, they're going to look at your 23 return, etc. Here's the other thing you can do though. Let's say that's the opposite, where I had all this income and I retired. I deal with a lot of physicians who have, a lot of income. And they go, well, Jim, I've retired. Do you know you can actually go to Social Security, because they handle the money side for Medicare, and say, listen, I've had a life-changing event. I've had work, they call work reduction, work stoppage. You can have a past of a spouse, any type of life-changing event. They'll look at adjusting it now. So you don't have to wait for 2 years to have them do, the look back. So we always encourage people, you can call me, I have those forms, I can email you, but you always want to try and get that bumped down. This year, just to keep rattling on here. So if you're an individual and you had more than $97,000 of modified adjusted gross income 2 years ago, you're going to pay more than the standard Part B premium of $164.90. So the government likes higher earners. And for a couple, if you file a joint return, you simply double that. Next year, the threshold is going up to $103,000 for an individual, and you double that for a couple, which would be $206,000. So if your income is under that from 2 years ago, you're going to pay that standard Part B premium next year of $174.70 a month. It just went up. They just announced those new rates. But again, you should always try and get it lowered. If you're in a higher bracket and you're retired, you want to go down and try. It doesn't, all they can do is say no, John. So you always want to try and see if they'll bump that higher. It's a surtax and bump that down for you.
Great. Next up, is there any insurance that covers Christian Science visiting nurse care? Medicare doesn't cover it.
Yeah, so I gave that some good thought, and I can't think of any. Jim, have you heard of any?
No, well, not to keep talking about long-term care, but the indemnity type long-term care plans where they pay you a cash benefit. There's not very many of them. That's why I like the nationwide one, and there's a couple others in other states. But that's where they pay you a cash benefit, and I can do whatever I want with that money. So if I wanted to have a Christian Science nurse come in, I could pay them cash, because if I've got let's just make a simple example. If I have a $6,000 a month benefit and I've qualified, right, I can show the insurance company that I need to receive that benefit. They're sending me a check every month. That's $6,000. I can do whatever I want with those monies. So that's the only way I can think of that they would be able to use the monies to pay for a Christian Science nurse.
The other thing just to be aware of, if you're not already, at Ardenwood, our hourly rate for visiting Christian Science nurses is $60 an hour. If you need us in the middle of the night, we charge a little bit more, $85 an hour. And so sometimes people find that amount to be manageable from their own checking account or savings account. If indeed they are in a financial need kind of a situation, there are, John mentioned on Tuesday about the National Fund for Christian Science Nursing. That can also be applied to for help if there is a financial need. So those are some things that we've seen.
Perfect. Thank you both. Do I have to be an AARP member to get one of their Plan G plans?
Yes, you do. And I know the price just for a year, it's $16. But John, if you call AARP, no, that's a commercial, but normally they're master marketers. So if you call in, they'll probably offer you 3 years at $12 a year, and they'll probably throw in a duffel bag for you too. I don't know. I just know that you have to have it when you first start to get Plan G. So, and that price is good for both you and your spouse. So it's $16 for the year it covers both of you.
Oh, that's great. Next up, Nancy mentioned the care need test when in a Rinky. Can you explain that more, please?
Sure. For Medicare to actually pay for one's care at a Christian Science facility, a Rinky like Ardenwood, the care need has to qualify. And we mentioned that the care need would be similar to one that someone who wasn't a practicing Christian Scientist might need to go directly to the inpatient hospital for that care need, or skilled care rehabilitation type of a need. So those are the two equivalent care needs, if you will. In addition, or to help explain it a little bit better, perhaps, this would need to be a care need that couldn't be cared for at home. It needs to be cared for by a skilled Christian Science nurse in a facility, in a Christian Science nursing facility. And it needs to be at a level that a Christian Science journal listed nurse would need to be supervising and making sure that the right care was being given, which means assessing the needs as to how best to support healing. And their a journalisted nurse would have the experience to do that in an excellent way. So those are some of the ways to help you understand what the quote care need that would qualify is.
Exactly. And everyone's trying to do the right thing. So that's why there are tests, as was mentioned, or a need that would qualify or not qualify for Medicare coverage. So,
and John, I thought I should just make sure it's clear. You know, just because the care need isn't qualified for Medicare doesn't mean you can't come to Ardenwood. Of course,
exactly.
you can come to Ardenwood and receive care. We care for people all the time that aren't perhaps at the Medicare level. So that it's just, as John said in his opening remarks, it's really just how you would pay for a care need if it qualifies for Medicare.
Perfect. Exactly right. I have Plan N as in Nancy. How does it relate to Plan G?
It's close. Plan N is normally less expensive, but you have still have the Part B deductible, and you have some additional co-pays. And take it one step further without boring everybody on here. You may have to make sure that the doctor takes assignment from Medicare. Assignment means the physician agrees to take payment in full. With Plan N, if there's a physician, they're allowed to actually balance bill you of 15% more, right? It's called a limiting fee. So they can actually balance bill you on Plan N. I like Plan G simply because it's easier. I don't have to worry about if I go to the emergency room, what's my copay? If I see a physician, what if you just don't have any of that stuff at all. Plan G to me, it just makes your life easier and simpler, quite honestly. And the premiums aren't that far apart. Usually they're not that far apart to justify going to N. And that's my personal opinion.
That makes good sense. Is Plan F a policy that lasts forever?
Yes, as long as you still pay the premiums, right? They're contractually guaranteed renewable. As long as you pay your premiums, they cannot cancel the plan. The only thing, if the company was to go under, right, and no longer have that, you'd still be eligible to move that plan to another company. So you're going to be protected no matter what. Just make sure. That's why it's so important we put people on auto draft for those monthly premiums. So it's coming out of your checking account. I've been doing this a long time, and I've seen when a lot of people go, I don't want that anybody touching my bank account. And I go, I understand things happen and they don't pay those premiums, right? They forget. As we age, sometimes we forget to pay bills in a timely manner, and that's not good. You do not want that policy to lapse. So.
Great. And that was the 1954 or before. You'd have to be
right. Correct, John.
To be eligible for Plan F as in Frank. Okay. What is the penalty for changing from Plan N or any other plan to Plan G?
Yeah, there is no penalty. There's none. The penalties on the government side if you didn't enroll for Part B on time, right? But supplement N or G, again, you just have to qualify, be able to answer those health questions, no, and you can move from N to G.
Great. Next up, to figure out the penalty amount, do you look at the tax year that's 2 years prior to the year you want to sign up for Plan B?
I'm not sure I understood the question, but the government's looking.
It's a 2-year look back.
They're looking to adjust your premium, right? So if it's in 2023 now, they're looking to your 2021 return. They would be charging you 10% of the Part B penalty. So this year it's $164.90. So you'd pay 10% of that for 1 year, 20% for 2 years. If it was 10 years, you'd pay 100%, right, of that $1,694. Did that make sense? Hopefully I didn't have my calculator here, but I think that was right.
Yeah, it's 2-year look back is, sorry.
Yeah.
Would it be correct to say, Jim, that the penalty is based on your age? When are you starting it versus the age 65, right? That's the penalty. Right, for Part B. But the actual premium involves that 2-year look back. Is that right?
Yes, right. And it can be adjusted, right, every year. So, from $164.90 next year, the Part B premium at $174.70, you're going to take a bump on that also.
Mm-hmm. Right? But I wonder if the person is also asking about, perhaps they have the higher level of income and are aware that their premium is going to be higher because of that from a 2-year look back. Is the 10% penalty on the higher premium then, if they have that higher income?
Yes, yeah, it's based on, they call it an IRMA, an income-related monthly adjustment amount. That's the surtax they charge you based on certain income levels, right? On your modified adjusted gross income. So yeah, it would be based on that.
Hmm.
And they would adjust it too, right? Is that if that IRMA goes down in a couple of years, right? So if I'm a higher earner and 2 or 3 years from now, I don't have that income anymore, it would automatically drop down. So would the 10% penalty because it would be on a lesser amount.
And so, so that person, let's say that was the case. So they look back 2 years. Now the premium's a lot higher than just the normal 164, but it's 10% of that premium, even
Yes.
though it might be 7 years that they have to.
Well, they're going to look at adjusting it, right? Every year they're doing a 2-year look back, and it's going to be based on the new Part B premiums. So just bottom line, if I was a 10% penalty on 164.90, next year it's going to be based on $174.70. So it's going to be a higher penalty, right? The penalty will increase next year.
Oh, okay. So
Yep.
you're helping
They'll
me, and I
calculate
hope
it
I'm
for
helping
you.
someone else. But the penalty then is
Right.
based on the smaller amount, the basic amount, the $170.
No, it can be based on the IRMA amount too, the
Oh.
higher amount. I'm just giving the example of somebody who just had that penalty. It's going to go up next year, right? Your 10%, so based on the standard $164.90, it's going to go up to that $174.70, 10% of that. So it's a little bit higher. But you don't have to worry. The government will calculate it for you and make sure they send you the bill.
Exactly.
So
Yeah,
that's all we want to do is try and help people avoid that if possible.
perfect. Next up, I'm retired military. What is required for me?
If you're TRICARE for life, then you need parts A and B of Medicare. You can keep TRICARE and they have credible prescription drug coverage, so you're going to be okay there. VA is different than TRICARE, right? And I'm just going to leave it at that. If you have VA, you have the option. You don't have to enroll for A and B, but they do recommend that you get it in case you can't receive services at the VA. I can go outside the VA, especially if I want to receive care, for example, like at Ardenwood, right? I would definitely want to have A and B so I can go to Ardenwood.
And I could say that we have had patients that had TRICARE for life with their Medicare, and the TRICARE for life, for our purposes, acted like a Medicare supplemental policy.
Perfect.
Works very smoothly. Next question. Are there states you can't work with, Jim? You or Katie?
There are some. New York's a big one. There's some states that are very easy to work with, and there's some states that are a lot more difficult. So right now we're in about 32 to 34 states. New York, though, is one that we do not work in, but all the states around New York we do, surprisingly. So from Massachusetts to New Hampshire to Connecticut, I just did some talk to some people in Connecticut today. So, but New York's one of them.
Great. Okay. Next question. Our broker has told us that the drug plan is required in order to purchase a supplement plan. Not that he recommends it, but that you cannot get a supplement plan without the prescription drug plan, which costs about $9 a year.
Yeah, you probably want to change brokers because that's totally not correct. No, for most Christian Scientists, I recommend, you get the supplement. You do not need to get a Part D prescription drug plan. So that's absolutely incorrect. You don't have to do that. There are some, John, I will say this. I've talked to quite a few people, and if you don't want to pay that fine, this year there's some really low cost Part D plans out there. In California, there's one, and it's believe it or not, 40 cents a month. It's like unbelievably cheap. So if somebody didn't want to have a fine, then you could purchase that simply to stay away from the fine if you ever do need to add it on down the road. But absolutely, you 100% guaranteed you do not have to have Part D to get a supplement plan. That's totally incorrect.
Thank you. Next question. Do you need a prescription drug plan to have coverage against the cost of drugs that may be administered at a hospital or care facility? This might be like an emergency situation where you're taken there not against your will, but just perhaps you weren't able to make your own decisions.
That would be covered under Part B, John. If somebody's receiving care in an emergency room and they give you some type of infusion or IV or something like that, that's normally under Part B. That's not under Part D for drugs. It's under Part B.
Okay.
And if an inpatient, it would be under, in case somebody is looking at, it could be covered under Part A too, for Part A stay in a hospital too.
Right. Is there a Medicare plan that covers custodial care, for instance, help with bathing and dressing? If so, is there a time limit, or is there a supplemental plan that provides this coverage?
Yeah, unfortunately, no. Medicare does not. They only cover skilled care for a limited period of time. Custodial care is long-term care, help with the activities of daily living, and no, Medicare does not cover that, and a supplement does not pay for that. Again, you're looking at the long-term care policy type of coverage.
Great. New question. My spouse is 5 years older than I am and is covered on my health insurance. Can we wait until I turn 65 before signing us both up for Medicare?
Yes, the answer normally depends on the size of the group, which is really important. So if the working spouse works for a company with 20 or more employees, that's the rule, then the older age spouse does not need to enroll for Medicare, right? Can stay on his or her plan until the younger spouse is 65 or older. If that company is under 20, then the older age spouse must enroll for Medicare Parts A and B because that becomes primary. I know that sounds weird, but that's the government's regulations, not mine. So again, if it's a large company, you don't have to do anything. You just simply stay on your spouse's plan. When he or she turns 65, then you would enroll for Medicare. It would be a special enrollment period for the older spouse and then initial enrollment period for the younger spouse. Crazy, but true.
Great. Again, I keep saying the same thing, but why? That's why we have these webinars. This is really good information to have. Can you please explain the written election process for being able to go to a rinky? When and how do you make this election? What are the rules governing this election? Nancy.
Oh, that's a great question. The way that we do it at Ardenwood is when a patient arrives and they have Medicare, they have the Medicare benefit, meaning they're over 65 and they have original Medicare Part A or B. They then have the option of electing to use their Medicare benefit at a rinky. And to do that, you would sign a one-page document that basically says, I only want to receive my care at a religious, because of my religious beliefs, I only want to receive my care at a rinky. And I don't want to be receiving my care under the medical realm. And so you're telling the government that I'm making that election to have my benefits pay at a rinky. Let's see, the question was when, and did I answer all the?
When and how do you make this election? I guess
when
you
and
talked
how.
about the how.
So yes, and this document has to be notarized. And so we do have a notary available if somebody does come in and needs to be notarized on the day of admission for the Medicare benefit to then start be activated. So yes, technically you could sign an election anytime you'd like to. You don't have to be at a care facility to turn that election on. But it seems like most people, that's when it happens for them. And I should say, without going into too much detail, that is for the person who does it the first time using their Medicare benefit.
Right. If I'm still on a company-sponsored insurance plan, should I still enroll in Medicare Part A since it does not incur a cost?
Two thoughts. One, the government says, yeah, you can sign up for premium-free Part A. No harm, no foul. But if you're contributing to health savings account to an HSA, then you can't have any parts of Medicare. I like sometimes it's just easy. You don't have to do anything. You don't have to call Social Security and say, I'm not enrolling for anything. As long as the company has more than 20 employees, that's the threshold. You don't have to do anything. You don't have to enroll for parts A and or B. You qualify for a special enrollment period later on when you decide to come off the group plan.
And this is a little technical, but say, for instance, a company shrank. They did have 22 employees, for instance, and then after, due to different economic conditions, they have 17.
Yeah, that's thanks for asking that question, John. That is a tough one. They reassess every year. They have a look back. So next year they would reassess and base it on that number, right?
Okay.
If it's over 20 or under 20. It's a technical that's the easiest way to answer it, right? They're going to look next year. They're not going to change it on you right now.
But it requires one to stay alert, doesn't it?
Well, yeah, you would have to, and nobody, that's the problem. No, they don't tell you, right? The
That's the
government's
point.
assuming you're supposed to know that, and nobody knows that. I see people get into trouble that are highly intelligent, highly educated. They have way more degrees than I do. And they go, no one ever told me. How are we supposed to know that? Especially attorneys in smaller law firms, John. I see that a lot going, hey, my associate told me that's not true. And I go, well, it is, because if you have a claim and there's less than 20 employees, right? And you have a claim and you're over 65, the insurance company is going to look and go, John, well, there's only 14 of you. Where's your Medicare? Because Medicare becomes primary. And you're going, well, I never signed up for it. And the insurance company goes, well, we don't have to pay the claim. And you go, well, wait a sec, I thought it had to. And the answer is no. Under 20, it flip-flops. Medicare, you have to have parts A and B. That becomes your primary insurance. If there's 22 employees or 25, then you don't have to, because your group health plan is the primary insurance. Medicare recognizes that as the primary insurance. Medicare actually likes that you stay on the group plan because it helps protect the Part A trust, right? That's dwindling down. So that's the reasoning for that. I hope I answered the question. I went on, but it's very confusing.
It's tricky, and that's why it
tricky.
requires alertness on all of our parts, doesn't it? New question. What healthcare services that are available at a Rinky are not covered by Medicare or a Medigap policy? Well, visiting nurse.
If you're admitted into Ardenwood, the only thing that wouldn't be covered is any personal items you might be purchasing, or your notary fee. But the daily care is covered by Medicare.
Great. I'm enrolled in TFL. Gosh, I'm sorry, I don't know what that is. I'm in
TRICARE for Life.
Oh, okay, of course. I'm enrolled in TRICARE for Life as a retired military dependent, and I have Medicare A and B coverage. Do we need any other Medicare supplemental insurance?
You don't have to, right? You can go outside. I see some that do purchase a policy. It's totally up to the individual.
Okay. So on Part G, do you have to qualify for on a health basis, or is it the thing that can be added between October and December?
Yeah, no, the Plan G, that's a supplement. That has nothing to do with this open enrollment period. Now, that's based on your health. You have to answer the health questions for that.
Okay. How do you avoid penalties if you're over 70 and haven't signed up for Medicare?
Well, that's a question for the government, but you're going to pay, right, 10% a year. So in that case, it'd be 50% more. That's 5-10-year periods. So you'd pay 50% more than the standard Part B premium. So if it's $164 this year, you'd add another, what's that, $80 onto it. That would be 50%. But it's every month for the rest of your life. So sooner or later, that's why as a Christian Scientist, it's super important to look at your finances and to do the math. And I'm always big, you think about it, pray about it, take your time and decide, because you can't add Part B until the general enrollment period in January. So start thinking about it now, quite honestly.
Great. Can I get a copy of the health questions that would be asked to a supplement plan? I'd like to know ahead of time what the questions are. Good
Sure, I would
question.
be happy to. If you just send me an email, I'd be happy to send the booklet to you, which includes the health questions. Absolutely. I would say them now, John, but there's so many of them. They used to be pretty simple. Now they go into more detail. So I'd be happy to send that out.
Perfect. And once again, all internet, or rather telephone and email addresses will be available at the end of this webinar today. Just a few more questions here. We're at 5 o'clock, so we have just a couple more that are here. I get a monthly bill for Medicare Part B plus an IRMA. Is the IRMA add-on the reason why it's monthly?
You get a month. Normally, yeah, I guess the IRMA can be sent out monthly, right? It can be. Normally, again, if you're on Social Security, that's pulled out monthly, and if you're not, they bill you quarterly. So if the government, I've seen the government do 3-4 months instead of 3 months, 5 months instead of 3 months. So yeah, if they send it to you, it needs to be paid if you have the, and the IRMA, the acronym is Income Related Monthly Adjustment Amount. It's a surtax. Great.
Is this our last question, I guess? Our last question is, due to the extremely high cost of some prescription drugs, shouldn't most Christian Scientists have Part D as in David, even if they don't expect to need it?
That, John, that's an individual decision. And I think fortunately, you've helped educate me. When I first started working with Christian Scientists, I'm like, yeah, everybody, you need to get Part D or you'd be penalized. That's really a personal decision now, as long as you understand the consequences of having it or not having one. That's totally up to the individual. And again, there's some super low cost plans this year out there. So if somebody wants to look at that, they're very inexpensive. But again, that's a personal decision.
If I'm understanding the question too, I mean, if you have Plan B, or Part B rather, that would obviate the need for a Part D. You would be coverage because you'd be doing it against your own will, and it'd be covered under Part B.
Well, no. So Part B, right, is the outpatient side, or
right.
There's certain infusion drugs covered under Part B, right? But Part D is in drugs. That would be a separate Part D plan.
Right, Part D. Okay. Yeah. Okay. Next question. I guess we have 2 more, and then we'll cut this off in about 5 minutes or less. Nancy, would you please explain a bit more about the election form? I think you said it has to be done the first time you use Medicare. Does that mean if you use Medicare services prior to going to Ardenwood, there might be a problem with the election form going through? Great question.
All right. Well, thank you for that question.
Yeah.
If you've used Medicare at a hospital prior to coming to Ardenwood, no problem whatsoever. That's why it's called an election form, because you're letting Medicare know that as of that date, you are wanting to only have your Medicare benefits paid at a Rinky. So that's why you're electing or telling it and electing that purpose. We then will go ahead and file that document with Medicare so that they have on record that that's your choice. And that, assuming you have Part A, obviously, then we can go ahead and they will pay for your stay with the co-insurance amounts and deductibles that Jim has mentioned before. And so it doesn't matter if you've used your Medicare at a medical facility prior. Where there is some rules that are effective, it has to do with something called revocation. And I don't want to confuse people, but if you elect at a Rinky to use your benefits, and then let's say you go home and 2 or 3 months later, you feel that going the medical route is the best choice for you, and you use your Medicare benefits at a hospital, then your election at a Rinky has been revoked because it's one or the other. And so So now you've chosen that care, but let's say 6 months later you decide that really isn't what I wanted. I want to be back at Erinki. So at that point, when you come back, you would sign another election form because it's been revoked. And so you sign that election form. And there are rules about this. You can do that once with no time delay. If you did it another time, you'd have to wait a year before you could elect to be at Erinki again. And if it happened a third time, you'd have to wait 5 years. So the government just wants clarity on your choice, and it's always you're up to you, but you do have these rules you'd have to follow if indeed you elected to come back to Erinki after making a choice to go the medical route.
Exactly. And sometimes these things pop up that we're not aware of, at Ardenwood, so that it gets a little tricky.
Yes, I could elaborate a little bit about that if it's helpful.
Sure. Just take one moment, maybe.
Okay. So we have had instances where an individual will come to us and they sign their election form, and we're not aware that they have had an election in the past that has been revoked. And when we go to bill Medicare, they say, oh, that election form has been revoked, and then they won't be able to pay for that care. So it's just important to just be straightforward and upfront. There's no judgment going on. It's just helping everybody to understand the rules so that you understand what your benefit is.
Yeah, exactly. And the rules are real. Yeah. Okay, here's the last question. If you have used Medicare to pay for glasses or dental services, does that disqualify for Medicare help in terms of paying for Ardenwood?
That is a great question. And I'm trying to think. There have been times where someone used their Medicare to get a wheelchair at their home, and that caused a revocation. But again, it's only if the individual had been at Ardenwood, had elected to use their Erinki benefits, and then at a later point after the election that they use their Medicare for these other things, and it caused a revocation. Or sometimes when someone has a need, perhaps a hip needs to be set, and the doctor, they go to the medical route to get it set. They come to Ardenwood for healing, but they need to go back for stitches to be removed or a pin to be removed or whatever. That visit can sometimes cause a revocation that you have to sign another election when you come back. So you just have to be aware of these things, and we help you be aware of that, and you just communicate that information to us, and we can all be on the same page.
Exactly. The more information that's provided is incredibly helpful and necessary.
And
well,
just,
sorry,
to
Jim.
go on, just people want to know Medicare does not cover dental, vision, or hearing, right? Only on those advantage to the HMO type plans. They add that in as an enticement to purchase those plans, but original Medicare does not cover dental or vision.
Thank you. That's right. A better answer than mine.
No, yours is. I've learned
both. Yeah,
learn a lot.
Well, a good session today. Thank you, Jim and Nancy, and thanks for all of your good questions in our audience. Please don't hesitate to call on any of these individuals at any time, at Jim or Nancy. And Katie, when she's with us, she had a family event today, and they're all happy to help. One other resource that Nancy mentioned that you're welcome to contact is the Christian Science Provider Network, which works directly with Medicare on behalf of Christian Scientists and care facilities, as well as individuals. I guess that was Christian Science care facilities and individuals. And the website for that is csprovidernetwork.org, csprovidernetwork.org. Another resource for financial assistance available to all Christian Scientists and all ages is the National Fund for Christian Science Nursing, or NFCSN. The contact information for these resources is listed at the end of today's webinar in a few moments here. Again, the point is that it's wise to be thinking through your options now. And before we go, I want to invite you to attend our annual Christmas celebration coming up on Sunday, December 3rd at 2 p.m. Pacific. That's the first Sunday in December. You'll receive an email invitation in early November. You can register for all of our events on our website at ardenwood.org. Thank you all once again for joining us today. We look forward to seeing you again on Thursday, November 9th for one more Q&A session this year. Please share this with family and friends. And thank you both, and goodbye for now.
Yeah, thanks everybody.
Bye.
Nice seeing you.